Joining me on the phone this morning on Indiana in the Morning on WCCS is Tom Stutzman, Indiana County's Emergency Management Director. Tom, it is good to have you on the phone with us again.
Morning.
How are things going? I know that the EMA department has been pretty busy with trying to navigate the county through this COVID-19 pandemic, and it's been about a year now since things were first starting to pop up. So maybe you can kind of give us an update a little bit on where the county is as far as COVID-19 is concerned.
Certainly, Josh. Yeah, it's been almost a year, and it's been an interesting learning experience through that process. I don't know that we've ever had a global pandemic in 100 years, and of course today with technology and the sharing of information and the number of facilities that are out there that are caring for patients has dramatically increased since the pandemic of the Spanish flu 100 years ago.
Mm-hmm. So Indiana right now, it sounds like we're doing okay in some regards, but of course we're trying to get as much vaccine as we can, I guess, into as many arms as possible. And it seems that not only IRMC, but a lot of the local pharmacies are now beginning to receive a lot of the vaccines that have been ordered.
Yes. The vaccine distribution nationwide, there is a sticking point in there in getting the numbers out to all of the locations nationwide. Here in Indiana County, we've been receiving a small amount. I wouldn't say it's a significant amount based on our population, and it's been a challenge, not only for the local pharmacies but also the hospitals. I on a daily basis pretty much go through the website and look at who is actually taking appointments, who's fully booked with appointments, just trying to get a handle on what's available out there. And, we've had lots of conversations with folks about trying to set up a county-wide appointment or registry schedule. And it's at that point now where that's kind of difficult because a lot of those local pharmacies aren't necessarily local. They're part of a larger corporate organization. So we've coordinated quite heavily with Indiana Regional Medical Center, which is our one true local organization that can coordinate those appointments.
All right. So as we stand today, and you can give rough numbers if you want to, roughly how many people have received vaccinations? Do you have that information?
Yeah, Department of Health publishes that on their website on a daily basis where they're tracking the number of shots in arms, not only for the first shots but also the second. We're running pretty close to about 4,500 total with the first shots, and we're a little under, I think, about 1,600 with receiving both shots. So, the progress has been slow, and it's because of the availability of the vaccine. Indiana Hospital's getting about 975 doses a week, which truly comes out to about 1,100 that they can administer because of the extra dosages that are in each vial. And the majority of our pharmacies that are receiving vaccines are getting quantities of only 100 shots. So in reality, they might get 120, 130 shots, depending on how much is in each vial that they have the ability to administer. Mm-hmm. The hospital had consistently been able to do about 400 vaccinations a day. So when you look at, we got 975, maybe stretched to 1,100. That's 2 3/4 days worth of work each week that we can pull. And there's no guarantee that every week we're getting those.
Right. A lot of information has come out, though, over the past couple of weeks, and people, I guess, have been asking for it. I know that you normally give an update on the coronavirus situation to the county commissioners, and that's part of their public meeting. What's the best way that Indiana County residents can get information as far as COVID-19 in Indiana County?
Well, all of the Indiana County data is published on the Department of Health's website. Obviously, and I've told you this before, and I tell everyone I speak to, Indiana County does not have a county health department, so we are dependent on the Pennsylvania Department of Health for the information that is gathered. The Department of Health website includes the information on the locations where vaccines are available. It includes links to how to register, make an appointment at those locations. Of course, all locations statewide are still working in what's classified as the Group 1A, non-affiliated healthcare provider. And because of the lack of vaccine availability, they've had a hard time working outside of the over 75 age group, and even moving down to the 65 and older group, and then, of course, into the 16 to 64 with underlying conditions, which are all part of that 1A group. So the 1B folks, which are a lot of our first responders and some other, postal workers and restaurant workers and folks like that, they're still in that waiting mode because Department of Health has not granted authorization to move beyond the Group 1A yet.
Mm-hmm. So people just have to keep patient and keep the faith that we'll get there eventually.
Correct, and that's the key. Being patient. We obviously, because of the shortage of vaccine that exists nationwide, we're not all going to get a shot in the same week, and it's going to take time to work our way through the population and to get to those groups who are the hardest hit. That's the key here is looking at those individuals who have suffered the most by either their age group or by their medical condition or by their job classification, with the healthcare workers being in that group. Those folks all need to get first. So that's the goal.
All right. We're talking with Tom Stutzman, the Director of Indiana County Emergency Management. We were getting an update on COVID-19 in Indiana County, and we're going to now go on to the event that's going to start this weekend and actually run through the better part of next week, and that is another pop-up testing site that's going to take place in Indiana. Now, Tom, you were saying that this is going to be in, I guess we can say roughly the same place as the last pop-up testing site. It's going to be over at the Indiana Mall complex once again.
Yes, they're going to, the Department of Health, along with their subcontractor, AMI, is going to be in town starting Saturday, the 13th, and running through the 17th of February, and they'll be there from 9 a.m. to 6 p.m. each of those days. And they are, if you recall what we did back in October, they were using the old Bonton parking lot area off of the Warren Road entrance to Indiana Mall, and they had tents set up with drive-through testing capability. They're going to do drive-through testing again, and they will accept walk-up testing. But instead of trying to set tents up and have these people stand outside for hours on end in our beautiful winter weather, they're going to work from the mall, the old Bonton store entranceway that faces that parking lot. So they'll be staging their equipment and their personnel in there, and as people arrive, they'll come out and greet them and perform the testing and accept their information and coordinate it that way instead of having them stand outside for hours on end.
Do people need to get an appointment for this?
No, there's no appointments required. The testing is free. However, they ask that you bring an ID, and if you have an insurance card, either a healthcare or a Medicare, that you bring that card along. They are not going to bill the individual. However, they do maintain the ability to bill the insurance carrier for performing those tests.
Now, this is the second pop-up test site that has come in Indiana County. As we mentioned, the first one was at the Bonton parking lot in the Indiana Mall, and that one was, I think it's safe to say, it was moderately successful in getting people tested for COVID-19.
Yeah, the surprising thing in the numbers with that was that the number of people from in the county and the number of people from the rest of the Commonwealth of Pennsylvania that showed up to be tested was pretty much even. The last time we did this, they had 240 tests available each day.
Uh-huh.
Now, they actually had longer hours the last time, but this time they've made 420 tests available each day. So we've got basically twice the number of tests available in a shorter period of time. Our goal would be to, get as much testing as we can done. But, the last time we really only, we got about 1/5 of what we expected in the last go around.
So you're really encouraging everybody to get the tests done. This is really a great way to make sure that people can stay safe in this pandemic. It's a great tool.
Yeah, I mean, the majority of the cases that we're seeing anymore are the asymptomatic cases, and this is a good indicator to allow those people who might, they might feel like they've got symptoms, but they really don't feel that bad, to at least go get confirmation one way or the other.
All right. So, Tom, we're just about out of time. Is there anything else that you wanted to make mention about the free clinic or the or COVID-19 in general before we say goodbye?
Well, just Josh, that I want everybody to remain patient. Eventually the vaccines will be more plentiful, and particularly as we get into the Johnson & Johnson distribution where it's a single shot dose, I think that's going to speed up the process quite dramatically.
Excellent. Tom Stutzman, Director of Emergency Management for Indiana County, thank you very much for joining us once again on Indiana in the Morning. All the best to you, and I hope that a lot of people come out and take advantage of that free testing clinic that's going to start on Saturday.
Thank you, Josh. Thank you, Josh.